go ahead and we arrive to the step 9.1. That's a very important step. Why? Because this step shows you the new position of the upper central incisor that we have determined on the basis of the static, phonetic, and functional analysis. And we can highlight the difference between the initial position with the black dotted line and the final one with the continuous red line. But at this point, you can also modify all the values. Let me check with you. First of all, we can see you have some red numbers starting from the upper 11. You have 12.6, but we discussed already about this part. So we can still keep this length because the patient doesn't show all the length because you have a low smile line. But at the same time, we have a very good number in terms of rest exposure at rest, 0.4. So finally the patient can show some part of the teeth at rest. The ratio of proportion again will be 72%, not perfect, but not so bad. It's still orange. Then lower arch, 41, 8.8 millimeter length, 3 millimeter rest position. Both are perfect because they are green. Then we have overjet value, 2.8, perfect. Overbite is absolutely bad because 7.3. So, but what is missing now? It's missing one important step. We are talking about the full mouth rehabilitation. We are talking about the need, in this case, due to the big and important wear, so in this worn dentition, to increase the vertical dimension. Now, how much you want to increase it? More or less, we decide to increase 3.5 millimeters. But before doing that, there is another alert. You decide to alter the VDO. In order to optimize the value of the increase, push the red button on the top on this page to display the clinical information. So the app wants to tell you and to give you some tips, some tricks, some advice. So now we go back to continue, and now we push the red button. And you see, you have a functional aspect, video alteration, possible prosthetic option, overjet final value, overbite final value, aesthetic consideration, a lot of information, a kind of ebook behind, a lot of information. Not just that, we can also push on the left bottom, the eye, you see, close to the cancer modification. You push the eye, and you see that you have, again, possible treatment option on the overbite and overjet values. So improving the overjet with the following modification, improving the overbite with the following modification, acceptance of the value, even not ideal, etc., etc. So you have a lot of information here. You have really to have the chance to understand how much content is inside the app. Plus, go to the upper part on the left side. You see the question mark? The question mark, if you push it, look, is all the information how to use all the buttons. That not only in this screen show, but is shown in other screenshots, not just in this one. So this one is one of the screenshots where you can find all this information. This helping you a lot, incredibly. So going back to the main screenshot. Now, we increase the video, we set 3 mm.5, and you see that now we have a distance between upper and lower, of course, in normal. But you have to close it, you have a contact at the end. The final goal is to have a contact. So you have different options. For example, you can push on the upper right, lower. It means that now you can go down to the length, to the bottom, right on the bottom. You can push the plus, go. You try to be the contact, but you see, on the other side, lower 41, you see that you become from beginning that was green, 8.8, now overnight become orange, now 9.7, 9.8, now become red. So still, you have no contact, we have red number. Please consider that behind the lower value of talking about length, you have also the rest exposure that is 4.5, still green. It is much more important the tooth exposure than the tooth length of the lower, because you almost never show the whole length of the lower teeth. just in the case that you have over eruption. At the same time, I don't want to elongate so much the lower, so I go back and I will maintain like something like, let me say, 9.2. Okay, now we have still very good value of the rest position, the rest exposure. So at this point you have still no contact. What is the next step? Next step, you go again in the up part, on the upper, you touch the upper, and now you have to go to parietal thickening on the lower part. You have to add, so plus, push plus, you see, now you have a contact, possible contact. So we have increased the thickness of the lingual concavity of the upper teeth. That again will be, as we said already, maybe a full veneer. So an extended veneer to the lingual part. Now we have a contact and we have the chance to see all the values are okay. We have, only the length it is outside the right value, but we discussed already because you have lost my line, so that is not the problem. We can say yes, overbite, overjet are not perfect. Overbite is 4.2, overjet 3.5, even too much. We can reduce the overjet tiny bit, so we can go again to upper, and then to the incisal lingual displacement. You put this one, and you can arrive up to 3 millimeters, that is green. So it will be perfect situation now, and that is what we want to achieve at this point. That is what we want to give to our dental technician and to our colleagues, other specialists. So we can customize, as you have seen. You can accept the value that the app gives to you that are already great, or you can modify tiny bit and achieve best result. Now, from step 9.1, we go ahead